I want to welcome everyone. I'm Jill Shimoleski, and I'm joined by Dr. David Rosensweet and Dr. Holly Papanek. And we are delighted to have with us today Dr. Eugene Shippen, who has been in medical practice since 1973, so 50 years-ish, primarily in family practice for the first 25 years, and then the second half in endocrinology, focusing on men and women's health. He's been lecturing and training providers, including the andropause training program we have here at IOBIM. He wrote a book in 1998 called The Testosterone Syndrome. I have that book. I bought that book many years ago. Still a great read. And over the last several years, he has been doing a deep dive into breast cancer, and he is going to share his knowledge and findings with us today. So welcome, Dr. Shippen. We are so delighted to have you here.
Oh, thank you for that nice introduction. I'm really glad to talk about this because I think it's a very, very important, undiscussed part of breast cancer and hormone therapy.
Sure is. Bottom line, it's the bottom line in the hormone work that we're doing is preventing breast cancer.
Well, when you get through with the lecture, you'll have more tools. Hopefully, and everyone will, because it's all practical. Almost all of it is available to people without a prescription.
It's great, Gene. Shall we launch?
Let's roll. So the risk of breast cancer in the U.S. is estimated to be 1 in 8 women. It's fairly commonly known. Biggest fears are that estrogen is a prime factor in this depressing statistic. It's true, women with the longest, highest estrogen exposure, longest time to menopause, extension of exposure with HRT may have higher rates. Some of the earliest observational studies suggest that HRT could decrease or increase breast cancer, and the WHI seemed to confirm this. However, if one looked at the data, it's a combination of estrogen and synthetic progestins like medroxyprogesterone that were the cause. The women on estrogen alone were actually lower in risk by about 5%. But comparing the risks of HRT and vitamin D might make you think a little differently, that hormones are not the primary thing to be afraid of either way. It only changes the odds by a few percentage points. But what we can do with some of the preventive measures make a huge impact, greatly reducing the risk of breast cancer and many other cancers. One of the prime things that got my attention was the fact that latitude and UV exposure, i.e. vitamin D, phenomenally lowered the risk in equatorial areas, far higher than and any other factor. Also, Japanese, they're not equatorial, but they have various dietary things and health things that are different than us. And Japanese women have very low risk of breast cancer, but their rates go up to our rates when they move here. So this widely divergent breast cancer incidence suggests that many different factors are contributing to these differences. We know that diet, obesity, smoking, exercise, alcohol all have positive effects on breast cancer. Hormones, including vitamin D, vitamin K, melatonin, have huge impacts. Nutrients like iodine, omega-3s, latitude, UV, trace minerals, selenium, are very protective. But most importantly, since the COVID vaccines have hit the scene, we are seeing a huge increase in the number of breast cancers triggered by the immune deactivation of oncogenes by the vaccines. If we try to duplicate essential factors from these studies, risk can be reduced dramatically lower than any other hormonal risk. Next slide.
I think I'm on it. Isn't this it?
Yeah, oh, sorry. Well, interestingly, vitamin D and UV light are related, but each has different effects. UV light actually increases melatonin in mitochondria, but vitamin D is the primary source of vitamin. The sunlight is the UV light activates vitamin D. So humans are, well, unlike many other mammals, are required to get vitamin D from sunlight exposure. It correlates with geographic distribution very neatly. So incidence of northern latitudes are highest and lowest at the equatorial areas for breast cancer and many other diseases. There's almost no cases of breast cancer in the lightly clad peoples in the equatorial areas that get maximum UV and vitamin D. All major diseases of aging, like MS, are lowest in these areas and highest in the northern latitudes. So vitamin D correlates with the incidence and severity of breast cancer. Treatment results are worse when vitamin D is deficient. Most important, unfortunately, studies done to demonstrate benefits from supplementation are almost all based on very low doses, relative vitamin D levels, if you would make them equivalent to equatorial areas. In other words, the doses don't duplicate equatorial levels of vitamin D. So here's a graphic that shows as the level of serum vitamin D goes up, the incidence of breast cancer goes down. And it's not projected further, but at higher levels, it may get down to even lower, near zero levels, which is hard to believe. If you look at cancer mortality, we're looking at general cancers and geographic, you'll see there is a tendency for a latitude change, some exceptions, but it's higher in the northern areas and lower in the southern areas. So we see it even within the United States that latitude and sunlight have an effect. The clearest example of latitude versus a disease is multiple sclerosis. There's almost zero at the equator. And the highest levels going either way, south or north, go up dramatically. The highest levels reported are up in the Scandinavian countries. Same curve goes for breast cancer. So vitamin D is an anti-cancer hormone. What's interesting is that vitamin D and melatonin are present in all cellular life forms, from bacteria, plants, all animophyla, even fungi and slimes. They all have melatonin and vitamin D. Vitamin D controls over 2,000 genes, so it's therefore essential to most cell and organ functions, particularly cancer immunity. These include all cancer-related genes. Vitamin D is essential in controlling inflammatory and autoimmune diseases. Inflammation plays a large role in cancer. Normative ranges for northern countries are not equivalent to healthy ranges seen in equatorial areas. So what's been published as being normative healthy ranges are not necessarily healthy if you related them to the large levels of vitamin D that mankind gets in equatorial areas. So you can't, it's misconstrued that normal ranges that are published are healthy areas. So melatonin, we tend to think of it as a pineal and a sleep hormone. It's far more than that. It's, as I said, essential to all cellular life forms. Melatonin production steadily declines with every decade after age 3. So by the time you get to 50, your levels are down to less than 10% of what they were when you were younger. One of the most potent antioxidants that protects cellular integrity and mitochondrial integrity, genetic stability and repair, and with normal aging that occurs with normal aging. Melatonin, not necessarily just a pineal hormone, since it's produced in almost all tissues and particularly in the mitochondria. The gut produces 100 times the amount of pineal production. So the production in the gut can normalize the microbiome. I didn't know that. And it reduces leaky gut permeability, which is associated with many, many diseases. It enhances every major cancer function within our cells. This graphic kind of shows how long melatonin has been unchanged in the history of life on Earth. I mean, it's been there and it's persisted in all forms of life. It's got to be very essential if that happens. So melatonin and stem cells, melatonin's ability to activate and control stem cells forms the basis of its amazing anti-aging and anti-cancer benefits. Stem cells in all tissues provide the source of regeneration of healthy new cells that replenish aging cells in these tissues. Neural regeneration may be one of the key factors in delaying dementia. In cancer cell lines, cancer stem cells are resting cells waiting to be activation into new cancer cells. And they're the most resistant forms that therapy doesn't wipe out. Radiation and chemo frequently do not wipe out the stem cells. So recurrence of cancers relies on the resistant stem cells, but melatonin puts the brakes on activation and may redirect stem cells back into more normal phenotypes after the repair of mutated genes. Interesting, since you deal particularly with perimenopausal, menopausal women, melatonin preserves ovarian function, may extend fertility in the perimenopause. It isn't going to stop the final menopause, but it might extend it, but it may greatly reduce the dysfunction that occurs in the perimenopausal years. It's interestingly increased by progesterone and highest in the luteal phase, and that's the phase that gets disrupted during perimenopause most frequently. The drop in production parallels sleep disturbances. How many women have sleep disturbances in these times? And that sleep disturbances control the circadian rhythm. The circadian rhythm of hormones and immunity controls our health. So a disrupted circadian rhythm throws everything off and makes you more susceptible to all the diseases. Melatonin increases many of the anti-aging genes, SIRT1 and NRF2, and it decreases mTOR pathways, which all promote longevity. We think of it as a sleep hormone, but look at this busy slide that shows all the different beneficial areas that melatonin has. You can go around the circle: circadian rhythm, antioxidant, reproductive regulation, anti-aging, anti-tumor, anti-inflammatory, immune modulation. It's a pretty amazing hormone that doesn't get its due in medicine. This is a very busy slide, but it shows you that if you can see where all the little P's are, where melatonin may be having an effect. So almost every step in cancer initiation, promotion, growth are affected by melatonin. Tumor microenvironment, we hear a lot about that. And if you go down the line, proliferation, epithelial, mesenchymal transition, EMT, angiogenesis, and so on down, immunity, they all have steps that are related to melatonin. So there are many dietary factors that can inhibit breast cancer. We know that soy and most plant and fruit polyphenols contain phytoestrogens that are beta activators. Alpha receptors in general are pro-growth, and beta are these growth inhibitors and inducers of apoptosis. So you lose your beta compounds, you're going to have more pro-growth balance with any estrogen that's around. Sea vegetation contains many healthy compounds like fucoidins and trace minerals, particularly selenium. Iodine is high in kelp, but the 3,5-diiodotyrosine inhibits a specific enzyme, ApoBec, that promotes cancer cell growth. One of the more recent things that I started reading about was the Japanese adlai seeds. They're a food that's very much like rice, and they have some of the most beneficial effects on cancer and diseases. They use it as a longevity food. And I've never heard of Adlai seeds, but you can get it in tea. You can get powder to mix with smoothies, and you can get the seeds themselves that cook up like rice. Very easy to add to the diet. And the literature on Adlai for its many health benefits, including cancer, is amazing. So iodine we think of for thyroid, but it's really an anti-cancer element. There are two tissues in the body that concentrate iodine. In fact, they have iodine symporter that brings iodine into the tissues, and that's thyroid and breast tissue. We know that iodine reduces fiber density and breast cystic activity. And with deficiency, these changes are greatly increased in animal tests, confirmed over many years of my own experience. I have several cases of breast cysts completely disappearing with Lugol's drops, topically and orally. It can be used topically on the breasts as well. So kelp and sea vegetation are very high in the Japanese diet. And with iodine having this anti-cancer effect, it may be important at killing infections and other pathogens as well. The other things in kelp are alginate fibers that bind toxins, heavy metals. Dietary kelp has been reported to be a major factor in breast cancer protection in women who have the lowest levels of advanced countries compared to other countries. Interestingly, breast cancer rates increase when they move here. Fucoidins are compounds found in kelp in high concentrations. They're in other foods, but kelp is very high. They have many, many health benefits, including diabetes, insulin resistance, anti-inflammatory, immune benefits, particularly decreasing dendritic and natural killer cells that destroy cancer cells. They have specific anti-cancer effects, activating cancer oncogenes that decrease cell growth and decrease angiogenesis and promote cancer cell apoptosis. Unfortunately, the types available of fucoidin in supplements are only really available from Japanese sources that use high concentrations, and they are available on Amazon. But they need to be imported, and they're moderately expensive. They may be worth it if you're a cancer survivor or a cancer case. Selenium is an anti-cancer mineral. Selenium levels highly correlated with cancer rates throughout the U.S. Selenium is a cofactor for thyroid deiodinases and glutathione peroxidase, a major antioxidant cell protector. In both human and animal studies, selenium showed 50% reduction in mortality. Interestingly, the highest concentration of selenium is in Brazil nuts. So eating 4 to 5 nuts provides an RDA level. And the nuts are very low in carbohydrates, high in healthy fats, and they help lower insulin and lipid levels. They're very healthy nuts. One of the things that I learned was that the most important thing for monitoring breast cancer is your own hands. And unfortunately, women are not told how to check themselves with a lubricant versus just checking for lumps without a lubricant. The difference between a non-lubricated and lubricated exam is an immediate lesson. If you lie down as a female, lie down, do your exam without a lubricant, then add any kind of lubricant, oil, any slippery lotion. You'll immediately find you can feel all the little glandular elements in the breast tissue. So you will be able to find small lumps or changes if you do this on a fairly regular basis. Doing a self-exam without a lubricant is almost worthless. Magnesium is also very good for the breast and fiber-dense breasts, and you can add some Lugol's drops to that to get your iodine and actually deliver it right to the breast tissue. You can get the magnesium oil spray cheaply on Amazon, and just get Lugol's as well, and just add 10 drops to a 3 or 4 ounce bottle. Mammograms aren't good for younger women, so self-exams are needed after age 20. And since we're seeing breast cancer in young women now, it's important, even more important, that you learn to do good quality lubricated exams on a regular basis. So for protocol for breast cancer protection, optimize your vitamin D and K with a minimum of 10,000 daily of D and 150 micrograms of vitamin K that goes with it. Vitamin K also has some anti-cancer benefits. If you're high risk, have a family history, or you're post-treatment from breast cancer, optimal levels of D can be determined by increasing vitamin D and checking parathyroid. According to a physician from South America named Cicero Coimbra, who found that by increasing the doses, all the autoimmune diseases would go into remission. If you measured PTH to make sure that the vitamin D was not causing any adverse effects like hypercalcemia.
Would you track that
Melatonin
down,
I've been
Gene?
experimenting with myself, and I found that a lot of the tablets and available gummies and things are not very good sources. So I get it compounded. It's not terribly expensive, but it's much more better quality. 50 milligrams per cc in jojoba or even almond oil. And you can then titrate with drops sublingually to one drop is about 2 milligrams. So you can start off with 2 or 3 drops under your tongue. And then because melatonin has a short half-life, you can use it topically as well. And I use about twice as much topically to extend the effects of melatonin. The half-life of melatonin sublingually is only 40 minutes. So within 3 or 4 hours, whatever you took at bedtime is pretty much gone. So if you want to have that melatonin effect to your whole system, you need to use it topically to have an 8-hour half-life.
Can
High
I back
iodine
you up
kelp is
on
available on Amazon. 1,500 micrograms is 1.5 milligrams. And you can take the capsules 2 to 4 daily. I wouldn't go above 4, that's 6 milligrams. Brazil nuts can be included in the diet for selenium. I think that's a great idea. It's a good food, it's healthy. Fucoidan concentrates for women with breast cancer post-treatment is, I think, a good addition to your treatment protocol. And then the monthly exam for women over the age of 20, but I'd do weekly if you have high risk or had the COVID vaccines. New breakthrough in cancer mortality may revolutionize cancer mortality. Use of ivermectin, 2 safe antiparasitic drugs, which came up because of COVID, are now finding that many cancers are going into remission using these drugs. So it's a new approach to cancer that has great possibilities. Particularly, it's useful in conjunction with other treatments. So it's not necessarily a different treatment. It may be a co-treatment. Cancers have viral origins and or bacterial origins, and these safe to repurposed drugs have specific antiviral effects. There are ongoing trials now by the FLCCC done independently, looking at 5 major centers using ivermectin and mebendazole treatment in conjunction with other cancer treatments to look to see how effective this is going to be. Additionally, new research has indicated that cancer stem cells can be killed by a combination of antibiotics, azithromycin, doxycycline, and vitamin C. They seem to kill cancer stem cells. This was just recently published, but women that have had breast cancer may want to go on several cycles of antibiotics for 2 to 3 months to get rid of the residual cancer stem cells. Another breakthrough in cancer, I'd never known about the Rho GTPase kinases, but this genetic pathway has good and bad effects. If they're overactivated, they cause a whole range of diseases, including cancer promotion. They get more and more dysregulated with stresses, infection, and aging. So as we get older, the Rho genes get activated that make cancer become more likely to initiate, grow, and metastasize. They initiate every step in carcinogenesis, initiation, genetic mutation, growth and angiogenesis, and most frightening aspects of COVID and COVID vaccine spike proteins as they activate the Rho GTPase pathways with an explosion of new cases and acceleration of the transformation of cancer progression into turbo cancers of all types and all ages. There are some drugs that reduce the Rho GTPases, but most are in the pipeline. However, there are some widely used treatments, repurposed drugs, that show great promise. The abalone seed that I mentioned turns off the Rho kinases, which is one reason why it has such widespread anti-disease benefits. Mushrooms, and herbs like Scutellarium, vitamin D may have healing benefits from all of them inhibit the Rho kinases. Melatonin would join that group. The repurposed PDE5 inhibitors used for treating erectile dysfunction and some heart things are known to turn down the Rho GTPase system and have anti-cancer benefits as well. Just recently, a Japanese study was published in the Epoch Times. The study showed that 123 million of the population, 2/3 received the vaccination, and they had 116,000 excessive deaths reported above historic levels. The increases were 6 types of cancer: ovarian, leukemia, prostate, oropharyngeal, pancreatic, and breast, all sensitive to ER alpha. Interestingly, spike protein binds to ER alpha, upregulating transcriptional activity and to abnormal cell function. So this makes sense. mRNA vaccines induce the production of spike proteins inside the cells where they can easily overwhelm the ERA receptors. Frightening to realize that the two common vaccines, Pfizer and Moderna, have 13 trillion to 40 trillion LPNs. Those are little lipid nanoparticles per dose. They go to every part of the body and every tissue, and they don't turn off like they thought they would. They may continue in some people for up to 18 months or longer. I have personally had 3 breast cancer cases in my very limited practice, and friends. 2 were recurrent after 20 years, and I'll bet you Suzanne Summers had the vax, and she recently died of a recurrence.
Gene, can we ask you a couple questions?
Yeah.
You've spoken about monitoring vitamin D levels to include assessment of the parathyroid hormone levels. Would you elaborate on that?
Probably the most important discovery that I had during COVID and researching all the things, we found that vitamin D correlated very well with COVID severity, COVID deaths. Was a key thing that should have been promoted for everyone because it was so simple to increase vitamin D levels. But I was stuck with the old idea that you just needed to take 2,000 to 5,000 units a day to maintain, quote, normal healthy levels. So Cicero Coimbra treated MS and autoimmune diseases with gradually increasing doses of vitamin D until some people required vitamin D at 50, 100, or 200,000 units a day, which would scare any of the traditional physicians. So he monitored for toxicity, which basically is hypercalcemia and suppression of parathyroid by doing measurements. He also measured calcium excretion to make sure they weren't mobilizing too much calcium. He found that people that were resistant in vitamin D could tolerate these high doses and, in fact, required these high doses to achieve the full benefits in their autoimmune diseases. We approach it, take 2,000 or 5,000, or some people say take 10,000, that's a big dose. But that doesn't individualize the requirement that is determined genetically, or disease can alter your vitamin D receptors. Cancer cells obliterate vitamin D. They have enzymes that help break down vitamin D as a survival benefit. So with cancer cells, you need to have maximum vitamin D saturation to overpower the cancer cell's ability to get rid of vitamin D. And so vitamin D is required in much higher doses and should be in cancer or post-cancer cases titrated up slowly, maybe 10,000, 20,000, 40,000, or 50, with the checking of calcium and parathyroid. And what Coimbra found was a third of the people didn't require massive doses. 10 or 20,000 was fine. About a third required moderate doses, about 40 or 50. And a third required the real high doses of 100 or 200 or more. So it has to be individualized. And that's what he taught us, was that you can't go on a formula. You have to go on individual testing and follow-up of high-risk individuals or people that, if they have cancer, should be on a protocol where they get gradually escalating doses and monitoring with PTH to ensure that they're getting adequate amounts. He found that, for example, the autoimmune diseases went into remission when the parathyroid was lowered to the lower quartile of the normal range. In other words, if you're running in the middle or upper part of the normal range, that's actually too high. People in equatorial areas have lower PTH levels and lower bone loss. We live in higher levels, we get less vitamin D, we get higher bone loss, but what we need is individualized dosing. And that's the lesson that we're beginning to learn. And it's a big change in how we approach vitamin D.
So you wouldn't want calcium to go above the upper limit of normal.
That's right. The normal range is very tight.
Yeah.
And it's very accurate. So doing parathyroid and calcium will ensure that you're not over dosing the vitamin D. I've already had a couple people that overdosed and suppressed their either got calcium or PTH at 20,000, but all the rest are tolerating 50 to 60, 70 with slow, careful titration. And I'm seeing improvements in many different diseases.
Is there a number for the parathyroid hormone that you don't want to drop below?
No, the normal range varies by lab, but let's say 10 to 65, 12 to 65, you'll see. Coimbra found that levels below 25, between 10 and 25, was where he saw the best results for turning off autoimmune disease. And so you push the vitamin D level up according to the clinical response to the disease. Does the psoriasis go away? Does the rheumatoid arthritis quiet down? Does the lupus quiet down? Does MS takes a year to repair, but they get steadily better? So it's a slow titration process to the very high levels, and not many people are going to need those massive doses, but most people probably need more than 10,000. If they have any of the autoimmune diseases, they need titration and just careful medical follow-up. People shouldn't do it on their own.
Dr. Shippen, it sounds like you don't really watch the vitamin D level as much as you watch some of the consequences of it, as well as symptom management. Is that true? Or do you shoot for a certain level in terms of ordering some of the vitamin D levels in serology?
It's an interesting question. I do baseline vitamin D and parathyroid, and then I only measure parathyroid calcium.
Okay.
The reason is when you start pushing doses up to the higher levels, like I was talking about, 20, 50 or so, the 25-hydroxy measurements go above the normal range, and that scares people. And in fact, some of the labs will say, oh, above 100 is toxic. Well, that's just BS. That's not accurate. And it's been proven by many doctors using high doses and published results that 50,000 is very safe to take for 6 months. It's not likely to run into kidney stones or hypercalcemia, in many cases, but I still titrate up. But it's a cost. Why measure a vitamin D when you know it's going up? When really what you want to do is to monitor the parathyroid and make sure it's below 25 and not below 10.
Yeah, that makes sense. And it's interesting, Dr. Ryan Cole, through COVID, he was a big proponent of the vitamin D and talked about how COVID was really a deficiency in vitamin D in terms of that severity. I followed along with a lot of that data as well, too. It's fascinating you bring that up. in conjunction.
The interesting thing about vitamin D supplementation is it takes 4 to 6 weeks to convert to active or proactive 25-hydroxy that we measure in the blood. So if you have an acute illness, you need 25-hydroxy. You need even the 125 calcitriol immediately to get the benefits. So you can load up with vitamin D at the onset of your COVID illness. It isn't going to be helping very much because it takes too long to convert. There is a product available on Amazon called D-Velop, like develop, and it's 25 it's the only source of 25 hydroxy vitamin D, and I think each tablet is about 1,200 IUs. So if you took 6 tablets or 8 tablets, you're getting about 10,000 active forms immediately. And I had a Lyme patient, and I put her on the Coimbra protocol, but I started her with a 25 hydroxy. Within a week, the hand swelling went down, the fingers, joint pain and hand swelling went down that she had for years. So I knew I was getting effect. If I'd waited for the 50,000 to take effect, 4 to 6 weeks down the road is a long time, but you see it immediately. So anybody with an acute problem should use Develop safely. It has a half-life of about 2 or 3 weeks. So if you get a couple bottles of 60 and go, 8, 6, 4 every week, 8 a day for a week, 6 a day for a week, 4 a day until you finish, and then at the same time, put them on the little D3 to take over. And once you've gotten through that induction phase, all you need is the D3 to maintain the 25 level. So that's my new protocol.
Is there variation in quality of the vitamin Ds that are out there, and do you have any recommendations?
They're terrible. They're all over the place. You use pharmaceutical grade. There's one called Biotech. There's pure encapsulations. I'm sure there's some other brands, but I've seen Life Extension never got vitamin D levels up in people that were getting their cheap products.
How about pure encapsulations?
Are they that company a long time ago?
How about pure encapsulations? Is there
pure encapsulations pharmaceutical grade? Yeah, they have a 1, 5, and 10,000 IU.
Mm-hmm.
Biotech has the 5,000 and 50,000.
Wow.
And for those people that have autoimmune diseases, you just start off with a loading dose of 50 and give them 50 every day, and then recheck their parathyroid in about 4 to 6 weeks, and then back off if it's too much, if the parathyroid's too low. But once the tank is full, then you can titrate either way. I'd start off with 50 of Biotech, which is inexpensive and pharmaceutical grade.
How about ivermectin? Any recommended dosages for ivermectin?
There's the treatment protocol that the FLCCC is using is 18 milligrams average dose. Now they do it on milligrams per kilogram, so it's like 0.2 or 0.3 milligrams per kilogram. Ends up being 15 to 18, 20 milligrams. You can get that compounded at some compounding pharmacies, but anyone can call that has a cancer case that might want to join the study. And as I said, you can take it along with all the other treatments. It makes all the other treatments better. It makes radiation work better, makes chemo work better. So it's not in conflict with any treatment, but they should contact the FLCCC.
I know we brought this up at the before we went live and recording, but I wanted to ask it again. Is there an adverse influence towards the risk of breast cancer for women who've been on the birth control pill?
I don't think there's much of a difference between that and any of the, in a way, you would almost think that because they're giving lower doses, mini doses, that they're actually getting less estrogen during those reproductive years before menopause. So my guess is it probably has very little influence on the overall incidence. It does have synthetic progestins, which I don't like. I think they affect the pathways of progesterone activation that's protective. But they don't activate all the same genes. So there may be, in fact, some of them I think are more beneficial. Some of the newer progestins are not quite as bad as the medroxyprogesterone. Those medroxyprogesterone shots, though, they're terrible. They're just unhealthy for all women.
Interesting though, when you talk about that Japan study, I'm kind of bringing it back a little bit here to estrogen. That Japan study, correct me if I'm wrong, but they talked about kind of those equatorial differences, and that when those Japanese women moved to the US, their increase of breast cancer went up 600-fold, if I remember, per Dr. Jonathan Wright's work and kind of his review in his book. So clearly there's something equatorial vitamin D, but he also really equated it to estriol, which we know does not hit ER alpha, it hits ER beta, and just the overall importance of it kind of being deproliferative. Do you remember seeing anything in conjunction with vitamin D and estriol specifically, or this have been a different study perhaps?
The key is iodine. Iodine increases the metabolism of estrogens into estriol, directing it into estriol.
Yeah, which we know is so very
I've challenged your boss to try some people on estradiol plus the iodine and do your 24-hour urines and see if you can make estriol naturally like younger women do. And I do that in my practice, so I know it works. I have some unbiased and some on basically estradiol.
Women's bodies seem to love that estriol, so I just wondered if there's that vitamin D, or it sounds like the iodine is.
They make it in larger amounts with iodine, so.
Okay.
Get that iodine kelp. That is good for all women to take as a supplement.
What dosages of iodine? And of course, you're not talking about
not more than 6 milligrams a day. You get up to the tablets that are on the market. Iodoral, they're 12 milligram. That's too much. And I think the guys doing the urine testing were pushing high doses of iodine to normalize that. I've had at least 2 or 3 people get hyperthyroid from excessive iodine supplementation. So I draw the line about 6 milligrams, which would be, I think that's 3 drops of Lugol's. They're about 2 milligrams a drop, I think. And then the tablets of kelp or capsules of kelp that I've seen on Amazon, that 1,500 micrograms is 1.5 milligrams. So that would be 4 of those capsules would give you this maximum. So I wouldn't take more than 6.
5% Lugol's is 6.25 milligrams per drop.
Well, but the stuff on that you can get are 1 or 2% Lugol's.
Okay.
So, read the labels and kind of figure out the milligrams.
We had a really interesting discussion about using like 25 milligrams or even 50 milligrams doses of iodine in women with fibrocystic breast disease. And what was pointed out by this particular authority, they said that, the TSHs are going to rise, but you're going to see normal free T3s and free T4s, and the women feeling clinically really good and not having symptoms of hyperthyroidism. And it's because the TSH is used to stimulate the syntropin, which really facilitates transport of iodine into the cells. Do you have any comments on that don't be thrown off by TSHs on the higher dosages of iodine?
Well, I mean, in endocrine practice, we use massive doses of iodine to turn off the thyroid. If you have hyperthyroid, one of the treatments is to take the iodine medication and titrate it up in drops to massive doses, 100 milligrams or more. I don't use it, but so iodine is used to suppress it, but I've seen a few cases that triggered hyperthyroid by giving iodine. So you have to monitor that. I think the best practice is what I put in my protocol, is put some Lugol's drops into a vehicle. It's water soluble, so it goes right into a little magnesium solution that you can get, a little pump spray. Add the iodine to that and get it topically to the breast, where it goes right into the lymphatics, goes right into the circulation, goes right into the breast tissue directly. I think that would deliver more iodine than taking a big dose orally, which is systemically. You don't want to suppress the thyroid that way. And how long did they treat those patients? I wouldn't keep them on that for long, long periods of time at those high doses.
Myers used to paint the cervixes of women with fibrocystic breast disease. So the legend goes.
Just another way of getting it in the system. I
Yeah.
don't think the cervical route is any better than any other route. I think the best route is to put it on the breast tissue itself. I mean, doesn't that make sense?
That's a wonderful suggestion.
And it doesn't, at just a couple drops in 3 or 4 ounces, doesn't stain anything. So, and if it did leave a little residue, it absorbs quickly and it's gone by morning. So you don't have to do it every day. You're going to just provide iodine. And I like the idea of just a basal dose of iodine that's adequate, like the kelp tablets capsules will give you. And then maybe topically once a week or once a month do an exam so the breast tissue gets a blast of good iodine that may kill off some cancer cells with its cancer mechanisms, not just its metabolism of into estriol.
It appears to be so very important in the breast architecture itself, breaking down density and such too. Is there a test you do then to monitor what your iodine level looks like? Do you do the 24-hour urine or do you just supplement? What's your best guess in terms of, again, kind of individualization of therapy, 6, 25, 50? Is there a way you
I didn't find doing 24-hour urines. They were just a pain in the rear end. So we just know that we're not getting enough iodine in an American diet. So that's why I say get kelp is a good source of iodine. It's got all these healthy other compounds in it. Get some high iodine kelp and take that as a supplement. And then, for the case of fibrocystic disease that I had was actually a nun that lived in the convent and the area, and I was treating some of the people at the novitiate, and so she came to me. She had clusters of cysts on both breasts, like grapes. I'd never seen cystic disease like that, and mammogram was terrible, ultrasound was terrible, aspirating them was worthless. Didn't make any difference. I had her put iodine on the breasts, but I think I had her just swab it on make a solution and swab it on with a cotton ball. The cyst went away completely. She had normal exam breasts by the time they had all regressed over a period of a year or two. And so I know I lowered her breast cancer risk. I just talked to her recently, and she's been out of the area for 15 years. We stay in contact, and I call her my miracle, my one miracle. I've got to have another miracle till I can apply for sainthood. But amazing, complete reduction of cysts. That blew my mind. I've seen little cysts here and there, and you aspirate them and stuff, but this was just the worst case you can imagine, and it completely resolved and stay resolved. Went away.
Repeat that recipe. You used it in combination with a magnesium infused oil, or?
Yeah, that on Amazon you can get magnesium in oil. It's not oil. It's an oily magnesium, and it's got a lot of other trace minerals from the seabed or whatever. So you get magnesium from this trace mineral. And it's dissolved, and it has an oily, nice lubricating effect. And since it's water soluble, you can just put the Lugol's drops. And I just recommended 3 or 4 drops in about 6 drops, up to 6 drops in about 3 or 4 ounces. And it's a pump spray. So then it's easy to administer. You just squirt it over the area that you want to do the exam and rub that in while you're, extend it all the way to the upper chest and the axilla and underneath and in the middle. So it gets all the lymphatics pretty easy, and squirt, 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 check, 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 and you're done. I mean, it's one of the best early detection devices we have, much better than mammograms. If you do that, you're never going to miss an advanced cancer. You'll pick it up at an early curable stage in most cases.
Beautiful, Gene. Wonderful, rich presentation. Very, very grateful to you for your just in-depth. You take on a subject and you go after it.
Well, there are a lot of references, and I think I sent you some. Did you get references?
I'll check through my.
There's the Coimbra website. Everyone should, if they're interested in titrating vitamin D, if they're medically going to follow, if they're a medical person that can do the testing, PA, nurse practitioner, physician, if you're going to titrate up, go to the Coimbra protocol website and download or look at some of his case history, some of his little lectures. Some are in Spanish with subtitles, some are in English. And I got a book by one of his MS patients that detailed her long journey back from severe MS to near normalcy. Just amazing. We don't have anything that treats MS like that. Even the biologics don't have that kind of reversal. But then he found all the other autoimmune, the vitiligo would go away and the lupus and rheumatoid would go into remission. So the mechanism for autoimmune disease and cancer overlap. So vitamin D has to be a key at preventing cancer going forward and turning off autoimmune diseases if it's used properly. Mm-hmm. But the key is the individualization of vitamin D requirements that are not talked about at all in traditional approach to vitamin D. I mean, the Institute of Medicine is something like 400 to 2,000. Yeah. Is the recommended dose to prevent rickets. I mean, that's all they think it's good for. It's totally ridiculous.
For autoimmune, do the patients then stay on these high doses? Like once you're at that point where you've really brought symptoms down, then are they staying on these really high doses, or is it?
Very interesting question. The people that require the high doses are vitamin D resistant on a genetic basis. Their VDR has polymorphisms or some of the pathways are aberrant. They increase, metabolize it, break it down, whatever. So they're always going to need the optimal dose. And what Coimbra found is people that went off his protocol, their disease processes came back. So they weren't cured. They were controlled. But by turning off what we call the Th17 pathway for autoimmunity, that gets upregulated in all autoimmune diseases, it gets downregulated by vitamin D. Okay. So yeah, they have to stay on it.
Yeah. Okay. No, that's great to know. And melatonin, I know you mentioned melatonin can be, I didn't realize the half-life was that short. So you were talking about getting it compounded. What about like pure encapsulations does have an SR, like a sustained release? Is that going to last? Is it not? Are you finding that to be as effective?
When you take an oral hormone, it goes to the liver, and the liver obliterates a lot of it, and a little bit gets out in the circulation. So I'll share with you, I was diagnosed with a little early bladder cancer, so I started reading up about all kind of things I could do, and then I started reading up about melatonin, and so I started taking gummies and tablets, and I got variable results with sleep and that sort of thing. And I didn't realize it was rapidly metabolized and not really probably getting in. So I got to thinking about it, and they have sublingual tablets. And I thought, well, sublingual drops bypass the liver and you're going to get some absorption right away. But that's going to be gone in 3 or 4 hours. So topically has an 8 to 10 hour half-life. And although it's only 10% absorbed, you put 10 or 15 milligrams on, you're going to get 2 or 3 milligrams, which is a high dose. Cancer cases, they're getting up to 100 milligrams, 200 milligrams, 600 milligrams. I read several studies, but nothing has really come down the pike. And I think they're all giving it orally. I just think it makes sense to get a pharmaceutical grade melatonin from a compounder. It's going to cost you a little more. But if you have an important reason like I do to get my melatonin levels up, I think that's the healthier way to do it. There are some sublingual topical melatonins available on Amazon. I just don't know their quality. I think there's one that's 20 milligrams per ml, and that could be for somebody that doesn't have an urgent need and just wants to experiment with their sleep cycle, taking enough to get to sleep and waking up refreshed is kind of your endpoint. You could try those, and those are a lot less expensive. But for people that have a health reason to take melatonin, I'd get it compounded 50 milligrams per ml, and that's, I think, a very good way to do it.
Does that have to be prescription? Is that prescription only through the
You have to call that into the compounders.
Yeah. Okay.
And are they preparing that in an aqueous or an oil?
It's an oil. I think all the hormones have, lipid solubility, or
right.
lipid vehicles work a little better. I think he puts it in, I think it's almond oil, just because I think that tastes a little better than the jojoba. Either one would be a decent vehicle. It's a suspension.
So you're taking that sublingually, the almond oil melatonin?
Yep. I take my dropper, and I've worked up now to 10 drops sublingually, topically, sublingually, and then 10 drops. So I'm getting a total of 50 milligrams with my 20 drops. And I'll tell you, I get to sleep. I wake up at 3 to pee like everybody does. I go right back to bed and go back to sleep. And then I wake up earlier than I used to. I used to kind of drag myself out of bed at 8 and hope that I could have another hour, but would whip myself along until the coffee woke me up. Now I wake up at 6, 7, and I'm ready to go. I get out and have my coffee, read the paper, and get my stuff done before Judy gets up.
Gene, we thank you so much. We'll distribute this to many eager folks.
Glad to hear if you get some feedback. Send it to McCullough.
Yes, right.
It doesn't have the references there, but they're all based on references.
That's great.
What McCullough doesn't know, he doesn't know about Coimbra. He's the old school with vitamin D.
Got it.
So he needs to learn that.
All right. Anything else, Holly and Jill?
Fantastic. Thank you so much. I appreciate this so much.
Yeah, it was great. Thank you. Thank you.
Okay, great to talk to all of you.